Understanding heart block, a disturbance in rhythm. The heart, a tireless pump, relies on electrical signals to maintain its rhythm and effectively circulate blood throughout the body. Heart block occurs when these electrical signals are delayed or completely blocked as they travel from the heart's natural pacemaker, the sinoatrial node, to the ventricles. This disruption in the electrical pathway can lead to a slower heart rate and, in severe cases, compromise the heart's ability to pump blood efficiently. Healthcare professionals classify heart block into three primary types: first degree, second degree, with subtypes type 1E and type 2, and third degree, each distinguished by the severity of the electrical signal blockage. This classification system helps guide diagnosis, treatment, and management strategies for patients experiencing heart block. First-degree heart block is the mildest form, characterized by a consistent delay in the electrical signal reaching the ventricles. While typically not life-threatening, it warrants monitoring as it can progress to more serious forms. Second-degree heart block involves intermittent blocking of the electrical signal, leading to skipped heartbeats. Type 1 shows a progressively lengthening delay until a beat is dropped, often represented by a pattern on the EKG. Type 2 is more serious, with intermittently dropped beats without the warning of a lengthening delay. Third-degree heart block, also known as complete heart block, signifies a total blockage of the electrical signal. This is the most serious form, requiring immediate medical attention as the ventricles receive no impulses from the atria and may beat dangerously slowly. Understanding the nuances of each heart block type is crucial for healthcare providers to provide appropriate and timely interventions to restore the heart's normal rhythm and ensure optimal cardiac output for their patients. Causes of heart block, from ischemia to congenital defects. A variety of factors can disrupt the heart's electrical conduction system, leading to heart block. These causes can range from temporary reversible conditions to more permanent underlying diseases requiring ongoing management. Ischemic heart disease, a condition where narrowed coronary arteries restrict blood flow to the heart muscle, is a common culprit. Myocardial infarction, more commonly known as a heart attack, can also damage the heart tissue responsible for conducting electrical signals. Medications, particularly those used to treat heart conditions like high blood pressure and arrhythmias, can inadvertently slow down electrical conduction and contribute to heart block. Beyond these acquired causes, electrolyte imbalances, particularly in potassium, calcium, and magnesium, can disrupt the delicate balance required for normal electrical activity within the heart. Congenital heart defects present at birth can also affect the heart's electrical pathways, leading to heart block in infants and children. Identifying the underlying cause of heart block is critical for healthcare providers to develop an effective treatment plan. While some causes, like electrolyte imbalances, can be corrected relatively easily, others, like ischemic heart disease, require long-term management to prevent further damage and complications. Recognizing the signs, symptoms of heart block. Recognizing the symptoms of heart block is crucial for prompting timely medical attention and preventing potentially life-threatening complications. However, the clinical presentation of heart block can vary significantly depending on the type and severity of the block, with some individuals experiencing no symptoms at all. Individuals with first-degree heart block often remain asymptomatic, with the condition only detected during routine EKG screenings. However, as the degree of heart block progresses, symptoms may emerge, signaling a more serious disruption in the heart's rhythm. Patients with second or third-degree heart block may experience a range of symptoms, including dizziness, lightheadedness, fainting, shortness of breath, fatigue, chest pain, and palpitations. These symptoms often arise from the heart's inability to effectively pump blood to the body, leading to decreased oxygen supply to vital organs, including the brain. In severe cases, untreated heart block can result in heart failure, cardiac arrest, and even death. It is important to note that these symptoms are not exclusive to heart block and can be indicative of other underlying medical conditions. Therefore, seeking prompt medical attention upon experiencing any of these symptoms is crucial for accurate diagnosis and appropriate treatment. Section 4, Diagnosis, Deciphering the Electrocardiogram. Diagnosing heart block relies heavily on interpreting the electrocardiogram, often called an EKG or ECG. It's a painless and non-invasive test that records the heart's electrical activity. The EKG provides valuable information about the heart's rhythm, including the rate and regularity of heartbeats, and can pinpoint abnormalities in the electrical conduction system. Each type of heart block presents with distinct EKG characteristics. First-degree heart block is identified by a prolonged PR interval, which represents the time it takes for the electrical signal to travel from the atria to the ventricles. Second-degree heart block type 1 demonstrates a progressively lengthening PR interval until a QRS complex representing a ventricular beat is dropped. Second-degree heart block type 2 shows a consistent PR interval with intermittently dropped QRS complexes. Third-degree heart block exhibits complete dissociation between the P waves representing atrial contractions and the QRS complexes, indicating that the atria and ventricles are beating independently. In addition to the EKG, other diagnostic tests may be employed to evaluate the severity of heart block and identify potential underlying causes. These tests may include Holter monitoring, which is a portable EKG device worn for 24 hours or longer to detect intermittent heart rhythm abnormalities. An echocardiogram, an ultrasound of the heart, provides images of the heart's structure and function, helping to identify any underlying heart damage. A stress test monitors the heart's rhythm during exercise to assess its response to increased workload. Accurate interpretation of these diagnostic tests is essential for healthcare providers to determine the appropriate course of treatment for patients with heart block. Section 5. Treatment and nursing care. Restoring rhythm supporting patients. The management of heart block centers around restoring the heart's normal rhythm and improving cardiac output, with treatment strategies tailored to the specific type and severity of the block as well as the patient's overall health status. While some cases of heart block, particularly those caused by reversible factors like electrolyte imbalances, may resolve with medication or lifestyle modifications, others may require more invasive interventions. Medications such as atropine may be used in emergency situations to temporarily increase the heart rate in patients with slow heart rhythms. Other medications, such as those used to treat underlying conditions like high blood pressure, may need to be adjusted or discontinued if they are contributing to the heart block. For patients with second or third degree heart block or those who are symptomatic with first degree block, a pacemaker may be necessary. A pacemaker is a small, battery-powered device that is surgically implanted under the skin near the collarbone. It sends electrical impulses to the heart to regulate the heart rate and ensure that the heart beats at an appropriate pace. Nurses play a vital role in the care of patients with heart block, providing both physical and emotional support throughout their treatment journey. They closely monitor the patient's heart rate and rhythm, blood pressure, and oxygen saturation. Nurses also provide thorough education about their condition, treatment options, and potential complications. For patients undergoing pacemaker implantation, they provide post-procedure care, including monitoring for signs of infection, educating on activity restrictions, and ensuring proper wound care. Additionally, nurses educate patients about their medications, including potential side effects and interactions, and encourage them to adopt heart-healthy lifestyle modifications such as regular exercise, a balanced diet, and stress management techniques. Understanding the different types of heart block and their EKG characteristics is crucial. Knowing the common causes of heart block, including ischemic heart disease, medication effects, and electrolyte imbalances, is essential. Recognizing the signs and symptoms of heart block, such as dizziness, fainting, and shortness of breath, is important for prompt intervention. Understanding the nursing considerations for patients with heart block, including monitoring, patient education, and post-procedure care, is key to providing optimal care.